Welcome to the VTube Podcast, a knowledge hub of VDOIT. Here we bring insightful conversation with industries experts, exploring how advanced technologies and innovation are empowering businesses. In this episode, we continue our discussion on AI in healthcare with Dr. Pawan Rawal. Now I am talking about something like a dream or a fiction, a technology which is actually happening, but people don't know. So, what is that specific? If you can give me one example that this is on the way and it can really surprise everybody. So, what is that specific technology?
Yeah, that's amazing. So I think what I would quote as a term called as robotic capsule. See, we
Wow.
already are doing capsule endoscopy.
Dr.
Where there's
Pawan,
a
robotic capsule.
capsule.
Wow.
Yeah. So there is a small capsule we have right now. It has the camera, it has lights, and you swallow and it takes the pictures. It's a high definition picture it takes. This is available since around 2004 or 5 we are doing it. But we expect a robotic capsule. What does it mean is that you have the capsule with the arms like a robot. You
Interesting.
swallow it, you play with the joystick as you play the actually video games. You actually modulate that capsule into the areas of interest you want, and it is actually therapeutic. That means you either control the bleed, you manage the issues, you take out the lesions, you manage the tumors, you actually help chemotherapy applied to the cancer inside. This is one we
My
are expecting,
God.
and this is very, very amazing thing, which probably would be actually it will not be a fiction. I'm telling this probably
This
will
is
be true.
reality.
Yeah, it's going to be true in next few years.
Wow.
Yeah. That will actually
And how big
dramatically
is the
change.
capsule? Is it?
It's the same capsule you swallow otherwise.
My
Yeah,
God.
it's like same 1 to 1.5 centimeter. That's it.
Wow.
Nanotechnology is coming into it. See, there are certain tumors or lesions which are not accessible by the normal stuff, and then you can't deliver the treatment to them. Now we expect some nanotechnologies to come up. They will be giving targeted delivery to those remotely located lesions. So these are some fascinating things we are expecting in next few years, and I believe that it will not be a fiction. This will be a truth and reality in next maybe few years.
And in this specific research, how far is India?
We are very close to it. Believe me, your country is not far behind.
Okay.
Yeah. We are almost using all the technology the world is using. Especially if we talk of, especially in my field, the gastroenterology and the intervention endoscopy, everything is available. We are doing in real time in this city, in this country. And of course, whenever we have the capsule endoscopy or robotic in picture, I think we'll have it very fast with us also. Though there are certain issues in the regularization and the permissions by the authorities, of course, that's there everywhere. So we'll have it. Yeah.
This is great news.
Thank you. Yeah.
So I'm coming to a very interesting round now of this series. And this may be asking some personal questions. And it's also called rapid fire. So are we ready for that?
Yeah, totally.
All right. So what's your favorite way to unwind after a hectic day at the hospital?
I love playing badminton. It's my hobby, it's my passion, and it gives me a lot of pleasure. It gives me endorphins, not only physical. So I play badminton and I play at a good level.
You play district or state?
Yeah, I played, and actually we won the state gold, but that was with the doctors. It was IMA state championship we won last year. So, but it's more of a hobby, and I play for myself. So that actually unwinds me.
Amazing. I think for patients who look their ideal doctor, I mean, they can take example of yours and make themselves fit.
Yeah, I think this is the need of the hour. The way we are going ahead with the technology, let's remember that technology has to come up with your health as well. Preventive aspect it has to be taken care of. You can't just go therapeutic. Once you diagnose the disease and treat before that, let's prevent it. That's more and more important these days.
Excellent. Next question. If you were not a doctor, what alternate career would you imagine for yourself?
It's difficult to imagine, though, at the level I've reached in this field last 33 years. But yeah, if you ask me, I actually used to play football. Actually, I qualified for the Subruto in class 10. I would have been a footballer if I would not have been a doctor.
Amazing.
Yeah.
Is there a hobby or activity you wish you had more time for?
I think I wanted to be a more creative person. I actually, like you guys, do something more creative than of course the medicos. I would have spent more time for research, which probably I believe this country is little lacking because we have a lot of workload for management of the patient. We are not able to spend time, actually that much time in research because it's too much hectic otherwise. Yeah, I dream a time where a clinician will be having enough time for research that will add to the value. So that I dream of.
Absolutely. Who in your family inspires you the most and why?
I'm blessed with a good families, but then if I answer the question what you asked is my dad and mom, especially my dad is a man with vision. He always taught us to dream far away what you are right now. And probably I will contribute, I will tell that he actually led us to think that far from this place and then think of the future and then dream of it and then achieve it also, of course.
Amazing. Now, describe your perfect Sunday in 3 words.
Difficult to describe because my Sundays are mostly in academics. Most of the conferences and lectures we have on Sundays. But yeah, if I get a leisure Sunday, I'll spend with family. So I'll spend with my family and we maybe go for a good walk or maybe we play the matches on the Sundays as well. Then of course a leisure lunch at home and sometime with the family outside in the evenings. That probably sometime I read books. So if I get hour or so, I'll try to read something. And of course, watch your podcast.
Thank you so much.
Yeah.
So, Dr. Pawan, now we are coming to the end of this podcast. So, one last. This is not about technology. This is more about your expertise of years, where I would like you to give a special tip to every audience of ours about their gut or maybe their stomach, whatever you like. So, one tip, please.
I would urge everyone to have a good and healthy lifestyle. And let me tell you, once you talk of healthy lifestyle, you talk of health. In a single line, I describe health as a state of mental, social, and physical well-being. These three things you should achieve. Any kind of progressive society or wealth is of no use if you don't carry health along with. So follow a healthy lifestyle, have a balanced diet, perform a lot of physical activity, avoid excess use of alcohol, no smoking. I'm telling no smoking at all.
Okay.
And of course, some leisure time and family time. That's very, very important. I think this you should follow. Whatever hectic schedules you have, try and spare out time for yourself. Bring a me factor in it always, especially if you're growing older. So bring a me factor for yourself because that's going to help you and others also in your family to go longer.
Excellent. Amazing, Dr. Pawan. It's not just healthcare, rather, it's more like a spiritual knowledge we are getting from you today.
That's the need of the hour, I think.
Thank you so much, Dr. Pawan. We are really very happy to have you here. And here we conclude our today's podcast. Thank you so much for your time.
Thank you very much.
Thank you. So thank you, audience, to stay with us and being very patient with our podcast where we talk about multiple topics. So please subscribe, give your comments, and also suggest if you like any other topic, any other expert you want us to bring in this podcast. Thank you, guys. Thank you.